Hey guys, it's Phil here. Today we're going to be talking about foot arthritis and how we can help here. So, what is foot arthritis? Arthritis is a very common condition that affects many of us. It's a very prevalent issue and affects our day-to-day activities. So, joint pain and inflammation is the most common factor that we see that affects someone with foot arthritis. This causes discomfort and swelling in the joints in the feet and can affect your movement throughout the day. Stiffness and reduced mobility is also another factor. It can severely limit the range of motion and flexibility in your joints. Types of arthritis. So, osteoarthritis is probably the most common type of arthritis, and that's just gradual wear and tear of the joint cartilage over a long period of time. Rheumatoid arthritis is an autoimmune condition, and this causes inflammation and damage to the lining of our joints, and often this affects many of our joints like our feet, our ankles, our fingers, and our elbows. Now, post-traumatic arthritis is a rare one, but it also happens to people that develop injuries to the foot or ankles, such as broken bones or severe sprains. Symptoms. So, symptoms are these are the most common: pain, swelling, stiffness, and reduced range of motion. All of these symptoms typically become one and are kind of really debilitating throughout a person's day-to-day activities. Some of the pain can be dull, or most of the time it can be aching, sometimes even sharpness in the joints of the feet. Swelling, this will also affect the amount of range of motion you can have. If there's a lot of swelling around the joints, you won't have enough movement in the joints. So, causes of foot arthritis. As we know, as we age, our wear and tear increases, and this, over a period of time, causes that bone-on-bone contact and the arthritic change. Injuries, traumatic injuries to the foot, such as sprains or fractures, even dislocations, can increase the risk of developing post-traumatic arthritis. Underlying medical conditions, such as rheumatoid arthritis, gout, diabetes, these all can increase the risk of developing foot arthritis. And obesity and weight gain, this excess weight places additional stress in our joints. So, the role of the podiatrist here that we provide a lot of custom programs and management, including the issue of orthotics, as well as strengthening and stretching programs that will help someone increase their ability to go about their day with the reduced effects of arthritis. So, treatments can include, but not limited to, medications. So we can recommend over-the-counter medications such as anti-inflammatories and corticosteroid injections to manage arthritis symptoms. Exercise therapy. These are probably one of the most common therapies we provide. A lot of strengthening and stretching exercises. This will help improve your joint mobility, strength, and function. Custom orthotics can improve someone's symptoms and support their day-to-day activities by correcting some of their joint stress. Surgery, in rare cases, sometimes we may recommend surgical interventions such as joint replacements or fusions to address your debilitating arthritis and your symptoms. So the benefits of visiting us: will manage your symptoms, which is the most important thing to help you go about your day with reduced stress. Improve mobility, so through interventions such as orthotics, exercise therapies, and even other devices, we can help you with your foot arthritis and regain and maintain your mobility and your joint range of motion to help you stay active. This long term also will help prevention of joint damage. So if we can intervene early and come up with a program to help you, we can reduce and prevent any long term damage and slow the progression of that condition. So, in conclusion, foot arthritis is very common and affects us in our day-to-day lives. Often, if it's debilitating, it can affect your quality of life. So that's where we can come in and help you out. So if you're experiencing anything of these symptoms, give us a call. See you guys.